So this is a very common myth that doctors are profiting off of, pushing drugs and big pharma, and that's all we do. We just want to push drugs and make money. But that could not be further from the truth. In fact, it's probably the opposite. First and foremost, if you are worried about your doctor getting paid off, it's publicly available information. There's a website, I believe it's called openpayments.cms.gov. I'll put a picture to the link here so you can see. This website basically has like a database of all the stuff we get from pharmaceutical companies or payments, and you might be surprised, pretty much it's nothing. The most I've ever gotten in the 7 years I've practiced is like a $10 Panera sandwich. And that's not even a prescribe or give anything. It's just to hear them talk about a medication or a formula and see if I like it or not. I don't get any kickbacks for giving those things or utilizing them in my practice. I get nothing in return, and this website basically shows that. And most doctors are like that, so we're not getting any big pharma paychecks or profits or money from them. Maybe years and years ago that was the thing. It's not anymore. There's laws in place against that. The other aspect of this is, and I can't speak for adult medicine, but in pediatrics, we actively try to avoid over-medicating children. We have a lot of guidelines and rules on antibiotic stewardship, meaning we don't want to use antibiotics unnecessarily on a child. We also have stuff for imaging. CT scans have a lot of radiation, so we have very strict guidelines to minimize using CT scans on children and irradiating them and going more to ultrasounds. We have a lot of rules. Pediatricians are, some of the least invasive doctors you'll meet. And we actually go out of our way not to give medications or not to do unnecessary imaging or tests unless we absolutely need it. And that saves the patient money, saves the patient time, and saves them possible consequences of those treatments. So I'd say this is blatantly false. We don't push drugs, we don't push medications. If anything, we do the opposite. We try not to overdo it or do it unnecessarily, and certainly we don't get any kickbacks from money from that. And one last thing I'll mention is it seems like it's damned if you do, damned if you don't in medicine. Unfortunately, when I prescribe a medication, I get accused of something like this comment, that I'm pushing drugs and I'm just trying to make money. But at the same time, when we withhold an antibiotic or withhold a certain medication or test, we also get berated. We're told we don't care, we're not listening to the patient, we're not doing enough, we're just saying it's nothing and letting them go. So what's the right answer here? If you prescribe medications, do tests, do imaging, you're villainized for, trying to profit off of a patient and, overdoing stuff and putting them on things they don't need. But at the same time, if you don't do those things, you're also villainized, that you're not doing enough, that you don't care. So what is it?